Good afternoon, everybody. Welcome to Grand Rounds today. Today, I have the pleasure of introducing actually three speakers. Linn Adams, Liza Maxwell, and Robin McKee have kindly accepted our invitation today to provide us with an overview of CICS and the services they provide to Central Iowans. And please join me in welcoming Linn, Liza, and Robin. Thanks.
Thank you. Good afternoon. I'm glad we're here today because I've already talked to one or two people who either said they've not heard of or aren't familiar with CICS. So Liza and Robin and I are here today to provide you some information so that you can be better informed about what our region is and what we do. I would just like to start out with a question, and at least for the people that are here in person, to just shout out, if you know, what percentage of adults in the U.S. experience mental illness each year? Anybody have any ideas? Some of you probably know because you've been in the field, but 25. That's pretty close. I did look up some statistics because I thought you might be interested in knowing. And so according to the National Alliance on Mental Illness, NAMI, they say about 20%. So I've heard anywhere from 20 to 25. So I think about 1 in 5 people experience some sort of mental illness during a specific year. And we will be talking about some other populations of individuals too. This would be just those with brain health issues. Some other interesting statistics that I got also from NAMI, of those 20%, about a quarter of those, so about 1 in 5 or 1 in 20 total of the U.S. population have what we would consider a serious mental illness. So about 20% have some sort of mental illness. It could be a mild mood disorder or anxiety disorder, and then about 5% of the population would have what we would consider a serious mental illness, such as schizophrenia or some of the other more serious mental illnesses. Another interesting statistics is that about 17% of youth in the United States, ages 6 to 17, experience a mental health disorder each year. And about 50% of all lifetime mental illness begins by age 14 and 75% by age 24. So that's about 3/4 of the people that end up with mental illness where it's could be diagnosed prior to the age of 24. And then this is a statistic you probably are already aware of, but suicide is the second leading cause of death for individuals aged 10 to 14. So just some interesting statistics for you about people with brain health issues. What are we going to cover today? I am going to cover the first couple areas there. I'm going to talk about, what is a mental health region and tell you a little bit about what CICS is and then who's eligible for our services. And then I will turn it over to Robin and to Liza to talk then more about specifically about what services we provide for both adults and children. So we'll probably just, if there's anything that I bring up during my part of the presentation that you have a question about, rather than trying to save it till the end, if you want to, we can take a couple minutes for some questions after that, if you have any questions related specifically to just mental health regions in general. Whoops. As you can see there, CICS is a 15-county region, and you can see the list of the counties that we serve. The map, I guess I can see it better on this screen than I could on my printed handout. So I just wanted to point out where our offices are. So we are a fairly large area. So we have offices in Garner, Mason City, Clarion, Hampton, Fort Dodge. In Hamilton County, we have one in Webster City, Eldora, Jefferson, Boone, Ames, of course, Marshalltown, Newton, Grinnell, Winterset, and Indianola. So we pride ourselves in providing services throughout the region, but we also pride ourselves in having those local connections so that we have a local office in each of our 15 counties. Just a little bit more about what CICS is and our staffing. We currently have 32 staff total in the region. We actually have 3 openings right now that we're advertising. But we also have a governing board, and we actually have Liza Hedden's here today with us. And Lisa, I know most of you know Lisa is, but she's also on our governing board representing Story County. We have supervisors, we have people from education, law enforcement, the judicial system, we have providers, we have individuals with lived experience on that board, and then we also have some family members of those individuals on the board. So it's a diverse board that we have, and there's been some change in that structure over the last few months. So we've got representation of all of those groups. We have a leadership team, which is 8 of our staff. So that includes our CEO, our financial officer, we have an operations officer, we have 2 planning officers, and then the 3 of us that work as coordination officers. And our service coordination is a big part of what we do. I call it the meat and potatoes of what we do, because really providing those services to individuals that need it is the most important part as far as we're concerned. So 21 of our staff or about 2/3 of our staff are in the area of service coordination. So we have our 3 coordination officers, we have 11 general service coordinators, we have 5 that are specialized in justice involved, so that would be working with people in jail, but also working with people in the community that are connected in some way with the justice system. We have 2 crisis service coordinators, and these are relatively new positions that specialize just in working for those individuals, and you'll hear more about the crisis services we provide, but working with individuals that would be involved in those crisis services. I do want to put a plug in. As I mentioned before, we have 3 openings. 2 of those openings are actually in Story County. So if you work here in Story County, we have an opening for a general service coordinator, and we also have an opening for a justice-involved worker. So if you know of someone that would be good, I know we have it on our website, that we'll share that with you later. If you know of anybody that would be good for those positions, or you could reach out to one of us also. This is just a map that shows you all of the regions in Iowa, and just a little bit of history. As you can see there, effective 7/1 of 2014, all counties were required to regionalize under Iowa Code Chapter 28E and create mental health and disability regions, basically to coordinate the non-Medicaid mental health and disability services. As it says, there are currently 13 MHDS regions. That has changed. That number has come down from what it was when we first started with regions. Some of you looking at that map might look at some of the boundaries of those regions and think, wow, that looks a little bit strange. Part of the reason for that is that when the regions were originally formed, counties had the choice to form allegiances and 2080 agreements with those other counties that they felt comfortable working with. So there are a few of the boundaries that do look a little bit different. As you can see, our region would be the region in the green in the middle part here. So we go as far north as, Mason City and Clarion and that area. We go west over to Fort Dodge, Jefferson, east over to Marshall County. Then we pick up Jasper and Poweshiek counties, and then we also have the 2 counties that are south of Polk County. So we kind of surround Polk County, except over here we have another region. Just for your information, one example of the changes, this region down in the far southeast corner that's all blue, that was actually 2 regions until July 1st of this year when they combined to form 1 region. Another change has been the Cross region, which is this pink region, clear south, and the Heart of Iowa region, which is Dallas, Guthrie, and Audubon. Those 2 counties actually have some sort of agreement where they now share their CEO. So there are some changes, I guess you'd say organically, happening within regions. So those are that's just a map that shows you kind of what the regions are in Iowa. Now we'll talk a little bit about CICS specifically and what we use for our eligibility criteria so that you're aware of if you have individuals that you want to refer, kind of who would qualify for services. So we do have 4 different areas of diagnostic criteria that individuals need to meet. One of those areas, brain health issues, or mental illness, intellectual disability, developmental disability, and brain injury. We'll talk a little more about that here in just a minute. Residency, they have to be a resident, be legally residing in the state of Iowa, and be a resident of one of our counties. I did want to point out that because Ames, with Iowa State University and the large number of people that you probably have come here as students, there are a few exceptions. So that, for example, if a student would come from another part of Iowa and come to Ames to be a student, they technically don't establish residency for the purposes of this until they would have lived here after college or stayed here. But if they come here as a student, they would maintain their residency in whatever region they came from during that time. There's also an exception for people that are incarcerated. And also, I think there's another area of, institutionalization, if somebody's like in a residential care facility. Another thing I just wanted to point out, as far as age, up until a couple years ago, primarily we served adults, but there were some changes made at the state level legislatively, and regions now serve for behavioral health issues anyway, we serve children and adults and continue to serve adults. As far as income, you can see there that we use the 150% of federal poverty level. That is a standard statewide amount that was set by the state many years ago. So currently that's not much. It's about about $1,823 a month is the 150% of poverty right now for FY23. But we do have a sliding fee for people who are between 150% to 250% so that they can qualify with, and then they pay a co-payment. But then for counseling and therapy services, we actually have a sliding fee that goes clear up to 500%, and that is both for kids and adults. Resources, we use the Medicaid SSI resource limits, so it's $2,000 for an individual, $3,000 for a family. And then we also do, once somebody has become eligible, we do an assessment. We do the locus and ICAP assessments for individuals, and that's what kind of determines what level of funding they would qualify for services. We also point out that we are the funder of last resort. That's by the state's rules. All regions are funder of last resort. So if an individual is eligible for Medicaid, or eligible for insurance, or eligible for any of the other programs such as, Iowa Health and Wellness that's now in place, or Hawkeye, people need to access that funding stream prior to the region funding the services. We do have, and you'll hear more about this from the other two, but we do have some services such as crisis where we don't actually look at their income and resource. The 4 different categories that we serve for diagnostically, brain health, we already talked about that. You can see there the definitions of kind of the criteria that we use for that. They have to have a diagnosis within the last 12 months of mental health, behavioral, or emotional. It has to be in, under the DSM manual. And it doesn't include substance, dementia, antisocial, developmental disabilities. Intellectual disabilities, there's basically 2 categories. One is their IQ. We look at IQ of 70 or below, and then concurrent deficits or impairments in adaptive functioning. We actually have the assessments that are done will show that. There's some actual tools that psychologists use to determine that, and then it has to be onset before the age of 18. And I did look up on the CDC, and they say about 2% of the U.S. population has an intellectual disability. The third area is developmental disability. And so that would, as you can see there, a mental or physical impairment. It has to be manifest by the age of 22, substantial functional limitations, and a need for services ongoing. And about 8.5% of children aged 3 to 7 have a developmental disability. And it is interesting that it says that almost 2 times as many boys have a DD diagnosis as girls. So I thought that was interesting. And then brain injury. That's about 1.5 of the U.S. population that has a traumatic brain injury, but we do serve individuals with brain injury. You can see there it has to be damage to the brain, and it has to result from trauma, infection, anoxia, vascular lesions, or tumors, and not related to something of aging process and it has to temporarily or permanently impair their physical, cognitive, or behavioral functions. All right, I will turn it over to Liza now.
Thank you, Lynn. So Lynn did a really good job of giving an overview of the region. I'm going to talk to you guys more about specific adult services that are available. So we consider there to be 3 groups of services. Crisis or emergency services are available for people that need immediate access to help relieve any symptoms or stress that have become too great for them to deal with on their own. Urgent services allow people to get help quickly or in the near future to avoid it from elevating to a crisis situation. And then we have routine and ongoing services that are in place, and sometimes they may take a little longer to get into, but they're designed to keep people safe and stable in their home communities. And I do want to clarify that all the services that I'm going to talk about today are services that we fund, not necessarily that we directly provide. We contract with agencies throughout the region to provide the services, and the only thing that we directly provide is service coordination. Okay, so a little bit more detail about the crisis and emergency services. The 24-hour crisis line is answered 24 hours a day, 7 days a week. CICS contracts with Foundation 2 to answer those calls, and they may try to de-escalate the situation over the phone, or they may dispatch mobile crisis. And people can also call 988. That is the national hotline now, but you'll get to the same place. It will direct you to this number. Mobile crisis is provided by Irely Ball. It works, so when mobile crisis is dispatched, a team of 2 people go to the scene. They're just in plain clothes and a plain car, so it's typically a little bit less intimidating than law enforcement showing up. They try to help resolve the issues right there, or they might problem solve for the next steps. They can, if it's determined that a person needs an evaluation, they can assist with that also. And anybody can call the line. It doesn't have to be the person that's experiencing the crisis themselves. It can be a family member, a friend, or even a stranger. If you come across somebody that looks like they might be in crisis, you can call for them and ask for mobile crisis to be dispatched. Mental health commitment can happen when someone is unable to recognize for themselves that they're experiencing that mental health crisis. Sometimes in those severe circumstances, the only option is an involuntary civil commitment. In order for that to happen, 2 people must present at the clerk of court's office and sign statements stating why the person is either a danger to themselves or others. If a judge agrees with their statements, they will order a sheriff to pick up the person and take them to the local emergency room for an evaluation. Once that eval is done and it's determined that inpatient is needed, they are then transported to a hospital where they can get further stabilization. Inpatient hospitalization can happen through a commitment or voluntary process by presenting at the emergency room. There, they're evaluated for inpatient or outpatient care. Crisis stabilization also may be an option that they recommend. And not all hospitals have a psychiatrist on staff. So CICS contracts with Integrated Telehealth Partners, or ITP as we refer to them, to provide those evaluations. So ITP allows a person to be evaluated by a psychiatrist or a psychiatric ARNP via telehealth at any time, 24 hours a day, which allows some of our rural hospitals to still have access to those evaluations. ITP also has a team of people that will help find placement if that's the recommendation, so that emergency room nurses don't have to do that, which frees up some of their time. Sometimes it can be difficult to find a bed, and sometimes there may be beds available, but there aren't staff on duty to staff those beds. Oops, I'm sorry. Transportation. So if a placement is recommended, we can assist paying for that transportation to the placement and home. So when the placement is involuntary, Iowa code requires the sheriff or the sheriff's designee to transport that person. And the sheriff's designee is Central Iowa Juvenile Detention Center, or CIJDC. And CICS also contracts with CIJDC for voluntary transports. 23-hour crisis observation is a service that someone can receive observation and supervision during a crisis for up to 23 hours. For CICS, this is only provided in a hospital setting and in situations where the individual does not need to be hospitalized, but rather a crisis can be resolved more quickly. Community-based crisis stabilization is fairly new. We've had that for the past few years, and this can be provided in a person's home or a safe place in the community. It's a service that lasts up to 5 days, where a case manager will come out and meet with that person every day, and they can help determine what is needed for them, help get them connected to resources, or if they are still experiencing a lot of symptoms or issues, they can provide the telehealth, either therapy or med management if that's needed. It's really a neat service because it allows a person to stay in their home or their community, because as we know, people have responsibilities and it's not always feasible for them to go stay somewhere else, even when they're having a crisis. And we do try to connect once those 5 days are up, and if they need further services, we want those case managers to connect with our regional service coordinators for further care coordination. Subacute services is a partial hospitalization. It's a wraparound care for mental health crisis, but for people that don't meet or no longer meet inpatient level of care. So often this is a step down from a hospitalization where, like I said, they no longer meet that level of care, but they're not quite ready to go home. So typically it's up to a 10-day stay for that further stabilization time. So more crisis and emergency services. The state of Iowa does have access centers. This is like a one-stop shop for people who are experiencing that mental health or even substance use disorder crisis, and they need immediate attention. The access centers often have subacute units and crisis stabilization residential units, and anybody can go to these access centers at any time to get that evaluation to determine what level of care is needed. And these are the centers that are offered in Iowa. Robin later is going to talk a little bit more about the children's units. So on to urgent services. Urgent services are those non-emergency situations, but they do need to be taken care of soon. So we know that it can take weeks or months to get somebody into therapy or medication management. Often that is too long for people that are experiencing those heightened symptoms. And so the region does contract with agencies throughout the state to hold some of those crisis slots available. So when somebody comes in, hopefully they can be seen within the next few days. So they don't have to wait for those several weeks or longer. We also fund mental health treatment in jails. So this can be therapy or med management. ITP that I talked about earlier, that they provide the assessments, the evaluations in the emergency room, they also can provide those Same evaluations in the jail via telehealth. There's also local providers, so it's not always ITP. Sometimes there's a local provider that's willing to go into the jail and do those assessments, and that's okay too. We also pay for the medications, if any are just psychiatric medications, I should clarify, in the jails. And then we have our Justice Involved services. The service coordinators that are Justice Involved are employed by CICS. They will often come and meet with individuals in the jails. They will get the appointments set up if that's requested. They set up the funding for those, and then they try to establish that relationship and rapport with the people while they're incarcerated. Oftentimes, that's the first time that we meet them or we catch them per se. So we want them to be able to transition with them into the community with that relationship already being established. Our hope is then that the folks that have started treatment in jail do choose to continue it as they transition into the community. Routine and ongoing services are for people it's to help people remain healthy and stable in their home community. So this is where ongoing services come into play. Outpatient services is typically what's thought of when we talk about mental health services. And that starts with a mental health evaluation by a licensed therapist. Then that results in a recommendation regarding therapy and medication management by a licensed psychiatrist or a psychiatric ARNP. Often we see individuals that are dually diagnosed with a substance abuse disorder and mental health, but it's kind of like the chicken or the egg, what comes first? Sometimes there's a lot of substance abuse that results in a mental health diagnosis, and other times somebody might have that mental health diagnosis and are experiencing symptoms or have suffered through trauma, and they self-medicate with substances. Recovery-focused services are more intensive than outpatient, and they're designed to provide support for the recovery from those suffering from the mental health diagnosis. Intensive psychiatric rehab is provided by a qualified psychiatric rehabilitation practitioner, where they work with individuals with serious mental illness, both one-on-one and in group settings, to help them learn how to set a goal, get that goal, and then keep it. That's a time-limited program. It's very goal-oriented, and it's up to 2 years. Peer support services are provided by a trained person that has lived experience. They are there and can model competency in recovery while sharing their own experience. Family peer support is a person that is typically a parent or primary caregiver of a child that has an emotional, behavioral, or mental health disorder. They work with families to provide support and advocacy. Coordination services are available to everybody. Integrated health program care managers, or care coordinators, or IHH workers is often what we refer to them as, or what you may hear. Those services are for individuals that have mental illness and have Medicaid. Medicaid-funded case management are for individuals that have other types of disabilities and are on one of the Medicaid home and community-based waivers, which Robin will talk a little bit more about those waivers later on. A few of them are the intellectual disability waiver, brain injury, and elderly waivers. And then once they're on that waiver, that qualifies them for case management. And then for everyone else, we have the regional service coordinators. And those are available to everybody in the region, regardless of their age, income, or resources. Everybody qualifies. We're often the bridge that gets somebody from they're just coming in the door, don't know where to go, don't know where to turn, to a longer-term case management like the ones I described above. So we offer that coordination and funding if needed during the time that they do become eligible for Medicaid. So we're often that starting point. We want people to come to us when they don't know where to go. We do a lot of resource and referral. We always say there's never a wrong call. Just give us a call. Even when we don't know, we work with people to try to find that answer. So it might not necessarily be hooking them up to a service per se. It might be helping them fill out a Medicaid application or food assistance. We want people to know what the resources are that are available to them. So if we don't know, we'll find somebody that does know. A lot of the services that our care coordinators refer people to are community-based services. These are designed to promote independence and well-being. These supports are ongoing and necessary for some people to remain in their communities, and at times it avoids institutional care. The list that you see here are some of the most common community-based services. Supported community living is a skill-building service that helps teach people some of the basics living skills that we might take for granted, like cleaning, cooking, hygiene, going to the grocery store. And then those services can be hourly. So depending on need, they might just need that 1 or 2 hours a week. And then that can go all the way up to a 24-hour or daily SCL, which is like a group site where people live together to receive that service. Employment services are designed to help a person work in the community. So that can start with helping a person identify a job that they may like or that might be appropriate for them. It can help with the application and interviewing process. And then once they find a job, we can get a job coach in place that helps them learn their job itself, helps them learn how to communicate with their supervisor and coworkers and things like that. Oftentimes, people start off with a job coach more often, and then as they become comfortable in their job, that tapers off and they're able to do more without their job coach. Transportation services help people have access to their community, whether it be for work, socialization, or other errands, just like grocery shopping. Dehabilitation is a recreational and leisure service as it promotes community integration for individuals with disabilities. And then I'm actually going to skip over the drop-in centers. I'll come back to that on the next slide and go into a little bit more detail. Respite services are available to help give a break for caregivers. We all know that can be exhausting at times, so respite is in place so the person that needs that care can maybe go stay with somebody else for even a couple hours or maybe a weekend. And then we do offer short-term rental and utility assistance or housing assistance. In order to be qualified for the housing assistance, a person must be engaged in mental health or disability services. And then a full list of services can be found on our website that describes each of them. Okay, so I told you I'd come back to the drop-in centers for adults. The list that you see here are the drop-in centers that we have in our region. They're really, like it says, they are just a place for people to go to relax, learn, socialize, or participate in activities. All the centers do function a little bit differently, but the concept is the same. We just want people to have a place that they can go and have people around that know what they're going through. So a place for them to talk to others. They also sometimes offer meals. And most of them have a shower. That's handy. Sometimes not everybody has access to that shower, and laundry, a washer and dryer. So that has been very helpful, I know, for some of the people that I've talked to that have utilized that. That is the conclusion for mine, and I will pass this on to Robin.
Good afternoon. So now before I talk about children's services, I'm going to talk a little bit about funding and how our service coordinators help link clients once they come in. They've identified a service, and then they work with them on how that service is going to be paid for. Of course, we do have individuals that have private insurance or Medicare. We also have clients that have Medicaid, and then the managed health care organizations, which currently are Amerigroup, Iowa Total Care, and Molina Healthcare. Iowa Vocational Rehabilitation Agency does work with individuals with disabilities on employment services and also works with them if they choose to go on educationally for a 4-year degree, a 2-year degree, or a certificate. And that's all in an individualized care plan. They do work pretty closely with individuals up to the age of 24. They've worked with individuals that if they have unfortunately chosen not to complete their high school education, they can help fund, it used to be called the GED, so I'm not going to say it right. It now has a new name for that, but they also help fund that service. Again, it's all towards helping someone gain employment. And then, like Linn spoke previously, then the regions are the funder of last resort. We do, as service coordinators, work closely with individuals on helping them apply for Medicaid and process that application. Typically then, once they apply for it, then there's more information that they need to send in, and we do work with them and help them either fax or scan that in. Some individuals don't have that ability to have that technology in their house, so then they do work with us so that we can help with that. The waivers. We also help people apply for home and community-based waivers. We often talk way too fast about our waivers, so it's a lot of times just HCBS services or waiver services. That does help people stay in their homes that traditionally might, without services, end up in a higher level of care, whether it be a residential facility, a care facility. Currently, in the state of Iowa, we have 7 waivers. I do know that there is some talk about changing that system, but as of right now today, we'll just talk about that, knowing that it's possibly going to change. There is the AIDS and HIV waiver. That is at any age eligibility. All of these waivers, you have to apply for Medicaid. So it's a twofold thing. You apply financially for Medicaid, and then there's an assessment that happens, and you are then eligible service-wise once the assessment is completed. We also have a brain injury waiver. That is a waiver that is up to age 65. And then there's the elderly waiver that is 65 and older. We work with the brain injury waiver. We do refer and help people with the elderly waiver many times. There is a health and disability waiver. We do a little bit with helping individuals do that. That is a much more medically waiver. So typically there's hospitals or a medical staff or a hospital social worker that might help an individual apply for that waiver. Then there is what we call the ID waiver. It's an intellectual disability waiver. An individual does have to have an IQ score of 70 or lower, and that has to be done by the age of 18. So I'll come back when we talk about children's services and talk about a little bit about transition services and how we help some families navigate the intellectual disability waiver process. There is a physical disability waiver. That waiver is ages 18 to 64. And that is when people apply for a waiver and then become eligible, they have a service menu that they choose from when they sit down with their team, and they can pick what services they want from that waiver, as long as it stays underneath the financial guidelines for that waiver. So for instance, the physical disability waiver, the family can choose services but cannot go over $730.90. And that's the case manager then sits down with them and figures out how many units of what service they want so that they stay under that cap. And then we have the children's mental health waiver that is up to the age of 18. That waiver cannot go over $2,077.57. For some of the other waivers, such as the health and disability waiver, the brain injury waiver, the ID waiver. There are 3 different levels when they do that assessment, and they would be staffed at reaching the level of a nursing level, a skilled level, or an ICF ID level of care. The nursing level, those services, if they were approved at that level, could only reach $993.56 a month. The skilled level would be $2,891.76 a month. And the ICF ID level is $3,875.80 a month. At one point, that whole goal was that your in-home community-based services obviously could not be higher than your daily rate if you were in a care center. That was the whole goal, to keep that under that. The elderly waiver is probably about a 3-month waiting list. That one goes relatively fast. Unfortunately, currently right now, the other waivers are anywhere from 1 year to 5 years long for that waiting list. And that's another issue that the Health and Human Services is working through. As I say now that they have 7 waivers, there is talk of changing that and obviously changing that waiting list. We have children that are on the Children's Mental Health waiver that actually don't get services from that waiver because they age out before their name comes off that list. If an individual is on some of these waiver waiting lists, then the region is able then to fund some of that gap funding while they're on that waiting list for certain services. And that would be the family just working with the local service coordinator to find that out. Now we jump to the Children's Behavioral Health System. In 2019, the state decided that the regions also needed to assist with funding some children's services. And then in 2020, I took the position as being initially the Children's Behavioral Health Coordinator for our region. That's where I met then Liza Heddens is on our advisory board, and also Dr. Jack Swanson is on our advisory board. So we have a list of services here that we'll talk about. The assessment and evaluation relating to eligibility services. So initially, if people come in, they want services, they've never been seen, we can help apply for and schedule those evaluations, and if needed, fund those. Behavioral health outpatient therapy, we can work with families on, again, identifying a provider and then determining whether or not they need some assistance with funding. A couple years ago, I want to say 2022, our region, CICS region, decided that we also were going to include behavioral health intervention services, or as everyone else calls them, the BHIS services, that we were going to offer that as a service. That service traditionally is funded if a child is on full Medicaid. If a child is on Iowa Hawkeye or has private insurance, in the past, families have not been able to access that service. But we now have decided in our region that we're going to treat that like an outpatient therapy. And so families can come in, they can apply for that service. That service is a service where it's a 2-part. The primary child gets individual therapy, but the family also gets family therapy. And it happens right in their home. And we go up to 500% of poverty. So some families that have private insurance there is a sliding fee scale, but that was a service that they never had access to prior to us offering that. Then we do have educational services, and then medication prescribing and management services. We can help families link with those services and or fund them if needed. And then there's prevention services, inpatient treatment services. Really, we're the funder of last resort, so that would be if there is no other funding available. One of the services that we have added with that behavioral health inpatient treatment is oftentimes children go to a behavioral health unit, and then they're discharged, and we're not quite sure if they're linked with services or not. That is one of the services that our new Children's Crisis Network Coordinator does follow through then. If that child goes to an inpatient and we know about it through an ITP that might have happened at their local ER, then she does follow through with the family to see what services they might want to link with after that short stay at the hospital. The crisis stabilization community-based services are the same as Liza spoke about. We contract with Irely Ball, and those services are a 5-day intensive service that can come right in your community to your home. And then again, help with assessment, maybe some medication prescribing if the child needs that. That service is without regard to income, as it's stated, because it's a crisis service. Crisis stabilization residential services, again, we started that about 3.5 years ago for children. We do contract with shelters here in our region, Youth and Shelter Services of Ames and Mason City. Those are actually shelter sites that we can access and use a bed there. Easter Seals is a crisis stabilization unit in Des Moines that we contract with, and we just started with one in Waterloo named Brownstone. Those are without regard to income. If a family has a managed health care eligibility, the managed health care will pay for 5 days. If the child needs to stay longer than 5 days to get those services wrapped around them, then the region has agreed to pay from day 6 through 14. Because they're a crisis service, it's without regard to income, but it's also a crisis service, as we know, does not often happen nicely Monday through Friday, 8 to 4:30 when staff are in the office. So parents can access those agencies and go right there to apply for that service. And then the agency has our paperwork and they get it to us the next working day. So it works pretty slick so that they're not having to then just say, well, you have to wait until Monday to apply for that service. We do early identification and early intervention. We try to work with families on that. And if we need some assistance and some more specialization, we often work with the satellite offices through the University of Iowa specialty clinics. Mobile crisis, again, is services that we contract through Irely Ball that come right to an individual's home or school or shelter or residential. I would say mobile crisis is probably accessed quite a bit through the schools in our area, and then they go out, they contact the parents that they are going out, and then they try to help figure out what is going on in that crisis and what they can work on with that. A couple of services that we don't have on here that I did just want to highlight that our service coordinators do. We work very closely with the schools, try to do outreach, try to share with them as many services as we can work with families. We also like to work with high school students, that transitional age. It is so important to be able to get those evaluations prior to the age of 18. And so we really work with the schools on the sooner that they can get us in there with transitional services. We work in partnership with Voc Rehab because they also have services for students. The whole goal would be that we would like it to be seamless from graduation to adulthood, that they've got those services linked up, and that they also have a plan like every other student that's graduating from high school. Eligibility for children's services, as I said, we do go up to 500% of poverty with a sliding fee scale. And resources, we do not count for families. When we look at diagnosis, we look at seriously emotionally disturbed. Some of those examples, and I'm just going to give you 3, the list is quite long, such as schizophrenia, bipolar, major depressive disorder. It is an assessment that a psychiatrist, psychologist, or an individual therapist have done, and how is that mental health diagnosis interfering with their daily living and their school life? And then they are the ones that then give that diagnosis. Providers in our area, we do have a long list of providers that we have contracted with. They are in our electronic system. So as an individual is coming in, meeting with the service coordinator, they want to work with, I'll say 43 North Iowa, because I'm more in our northern part of our counties. So we are able to pull up that contract and see, oh, this is exactly what they are contracted, the services. Yes, that fits. We could refer you to them. If we do have someone coming in and they say, I really want to work with this service provider, we can link them with our contracting unit to get a contract set up within our region. How to access services. For the purposes of today, because we're here in Ames, we have given you our Story County office. We just recently switched to a region-wide phone system. So the phone number is listed here, 515-513-6870. That rings in. They can transfer you to any worker within our region that you would ask to speak to. I do want to note that on our website, which is www.CICSMHDS.org, that has a full list and pictures of all of our service coordinators for each county, their phone number, their email contact. We do also have a site on our website that does allow for people to either apply online or actually just ask questions online through a media contact, and then that is checked daily and then passed through so that we can catch those people that have accessed that website at night or on the weekends. Our last slide is just, again, a map of the state of Iowa. It does give the website, because I know with Ames being a larger community, it's fairly close to Des Moines. You have many individuals that come here that are not necessarily from our region. So there is a website here that will give you all the region information and the contact for the workers in those other regions if you need to make a referral to them. And that is www.iowamhdsregions.org. And now we'll open it up for questions for any of us. Yes.
I have a number of questions. With regard to your funding, I know you get some money from Medicaid and Medicare, but how easy is it to get the Medicare managed care organizations to agree to the treatments that you want? I find Iowa Total Care has a policy of denying and delaying. So how do you feel you're treated by the managed care organizations?
Well, once someone has that Iowa Total Care or any of the managed health care, we do leave it up to them. We have had individuals that have come in and said that they were denied and that they didn't understand why they were denied that service. And we do kind of lean on the CEOs for the regions then to go directly to the MCOs to figure out and problem solve if that was in their contract, then why they weren't paying for it. We do a lot of gap funding. It seems that it takes a while for people to, when they apply for Medicaid, from the moment they apply until they become eligible, can be quite a long wait. And some of the services can't wait that long. So we do some gap funding and then work with them on getting that.
And I noticed at the beginning, you said that there were the services that weren't covered were substance abuse and dementia. So what do we do with patients who have dementia and behavioral problems? Do you cover those? And then Do you work with other substance abuse providers locally? Do you coordinate their care? Because you might have a patient that you've been following for a while, and then they get into a substance abuse problem. So do you coordinate your care with the substance abuse people?
Yes, yes. Often people have a dual diagnosis, so we do coordinate that care. But when we talk about that, we as a region wouldn't fund just strictly substance abuse or dementia, but the other funders that I listed, private insurance, Medicare, or the MCOs and Medicaid, they would fund those services.
Okay, so you do offer, if a dementia patient has behavioral problems, you do see those patients, you do help their caregivers?
And we try to problem solve with the team to see what services that we could link them with.
And I have a couple more questions. When you have a patient that needs a drop-down service or 23-hour observation, where do they go in Historic County?
I'll let Lynn answer that question.
Maybe, is there anybody here?
Nobody use the mic.
Is there anyone here from Mary Greeley? Because I do think that Mary Greeley does do 23-hour observation. It doesn't happen very often through the region, but I do believe that, I know they did offer that service, and I think they still do. What was the other part of that question?
If there's a crisis, where are your crisis centers? Is it a place, or how do you deal with the crisis interventions?
Well, mobile crisis, which these two talked about, that would be a primary way that they could get into our system. Usually, if people end up in an ER, then they would use. Liza talked about the ITP. Most of our rural emergency rooms, we have contracts in place so that they can be assessed there, because often those ERs don't have a professional mental health, or somebody that specializes in mental health there. So they can actually do that through telehealth, and then they can decide if they need to be, under inpatient commitment, and if so, then they actually help us arrange and contact all those other hospitals that have an inpatient unit like Mary Greeley to see if they have an opening and can take those people.
Yeah, it's my opinion, I'm a neurologist, but it's my opinion that Mary Greeley has been opening up more services for mentally ill patients, but unfortunately the funding is just not there. Do you get a lot of your funding directly from the state? And I don't mean Medicaid or Medicare. Do you get funding for your services directly from the state?
As of, is it just this July? As of this July, all of our funding is state funding now. There's no property tax in the system at all, so it's all state money.
And is it related to the population of the 15 counties, or how is it apportioned?
The formula is very complicated. I mean, it goes clear back to, I think back when Lisa was in the legislature, there was a formula set up for how regions are funded. And so we each, we get and then they changed that formula a couple years ago. I'm not an expert on it, but each region has an amount of money. And then if we don't spend that money, and then there's restrictions on our spend down also, but if we don't spend that money, I think there is still a pool at the state level that it can go then to other regions that may be struggling. Not a great answer, but I did want to, before people leave, or that we leave this meeting, I wanted to mention that we do have 2 baskets of goodies, I guess you'd call it, at the exit over in the back. There's brochures in there. There are brain stress balls. Be sure and take one of those with you. There's pens, there's notepads, there's crisis cards. If you want to take some back to your office, please do that, and then hand those out, because one of our big projects for service coordination over the past year has been outreach, and we've really been trying to reach out to doctors' offices and any place that may interact with people that may have mental health issues, so that we can get the message out about our region. So.
Thank you. And I will say, for anyone online, and you can take it back to your offices, I did grab
several of the items, and I will take them to the physician lounge so that they'll be available there as well.
Right.
And we have a couple online questions.
Oh, there's a couple online
Couple of
questions.
online questions.
So the first one is, how do you interface with Heartland Senior Services Organization?
How do you interface with the Heartland Senior Center hearing aids?
Well, to be honest and frank, there isn't as much interaction between the AAAs as we would like, probably. I mean, I know there's a meeting coming up. I know some people from our region are meeting with Heartland AEA, or not AEA, AAA. And I don't know if that's happened yet, but to try to strengthen that working arrangement. We do help a lot of people that turn 65 to try to get on elderly waiver. For example, if someone is on habilitation funding, which a lot of our people with mental illness are, when they turn 65, their eligibility ends for that funding stream. So then what we do is we try to see if they will qualify for the elderly waiver, and that will then help them, keep their Medicaid, and sometimes we have to transfer things over to services that are available under the elderly waiver for those people.
Okay, the second question is, does CICS pay for psychological medications when patients have no insurance?
Yeah, do you pay for psychological medications if someone doesn't have insurance?
Yes, we don't pay ongoing, but we will help out. We have a lot of people who maybe lose their Medicaid and, need a month's worth of medication. We help with that. We also fund it through, like Liza talked about, through the jails. So anybody in jail that gets psychiatric medications, we have arrangements so that we fund those through the region, but we also do that. I just had somebody within the last week that contacted our office and said her son had fallen off Medicaid. He had a fairly expensive medication. Could we help out for a month? So we covered that.
Okay, and one clarification from Dr. Stroessel. She says that Mary Greeley does not offer 23-hour observations for psychiatric services.
Okay. So I don't know we have other hospitals in the region that we contract with. One would be Mercy in Mason City. I don't know. We could check and see if they do the 23-hour observation. To be honest, there's, even when Mary Greeley did do it, I don't think there were a lot of people that used it because most people will need more than 23 hours. There's always the option of the crisis residential service, which, for example, in this area would probably we have a crisis center in Woodward, which isn't too far, and they can go there if they're in crisis and spend up to 5 days, and we can cover that if their MCO won't cover it. They can also go to the subacute right here in Ames. We use that as a crisis center. Even though it's a subacute, we will use it for crisis stabilization if someone needs to go there. And they can go there directly. We have several people who go from the ER here directly over to the subacute, and the region will fund initially up to 10 days. And then if additional time is needed, we sometimes have to extend that further. But the initial authorization would be for 10 days.
And one last question. Do police contact you in cases of homelessness?
Yes. Do police contact us in case of homelessness?
Yes. especially our justice involved service coordinators get contacted a lot by police and work closely with the police department. We now have some of our justice involved people who are co-located in some of the police departments. And so we are, ongoing, we're really creating better relationships with police departments. All right.
Thank you.
Be sure and take some goodies from the.
If you want to take the whole basket, you can take it to put in the doctor's lounge if you want to, seriously.
You don't want the basket?
No. You can take both, you can take both the baskets and distribute them to wherever you would like. Thank you.
Yes, thank you.